It's a spectacular start to the day at the air ambulance base at Essendon Airport. But flight paramedic Matt's first case is confronting. He's on his way to a critically ill schoolboy in country Victoria.
5-6 for taxi. The right left.
You guys secure in the back?
Yeah, we're secure, doors locked, mate.
The boy's panicked friend has called for help after witnessing a terrifying sporting accident.
We're doing high jump. He missed the whole mat and I think he landed on his back and he's just shaking.
Okay.
He's not saying anything. He's struggled breathing as well.
Since crashing off the mat in the gym, the semi-conscious schoolboy has been having violent fits.
There's crude head injuries. A patient will need to be sedated. He's highly agitated.
Disturbing reports from local paramedics at the scene are putting Matt on edge.
It sounds like he's had a loss of consciousness after he's hit the ground and he's very irritable and very unsettled.
Clear the trees now, just got the goalpost.
He's punching out, trying to hit people, trying to grab people, and so it takes 3 or 4 paramedics to actually hold him down and to be able to manage him.
Hey, how you going?
Very good, I'm cooking, mate.
That's all right.
We have got
Logan.
For his own safety, Logan has been heavily sedated.
So he's come from a fair height with a fair bang. He was altered conscious state from the get-go. Really difficult to manage. We're struggling to get baseline observations because he was just so agitated and kicking and flailing around.
Logan's dad, Chris, teaches at the school. For the last hour, he's watched on helplessly as his son has spiralled out of control.
Did you find any bumps, lumps or anything
No,
like that?
I didn't. But to be honest, it was really hard to assess him because he was just so mobile.
When somebody bangs their head and starts to display seizure activity, it makes me think that they've got a significant brain injury.
No, it's just a normal average kid, plays sports and so forth. Yep. What sports does he play? Footy, cricket? Footy and cricket.
Logan doesn't have a history of epilepsy, so I'm very concerned that that irritability that he's got going on beforehand was that he's actually had a bleed into his brain, which can cause him to deteriorate and obviously ultimately die.
What's his eyes doing? Is he about to have a seizure? It's okay, buddy.
Put that on a mute. Still trying to learn all these functions on this smartphone.
Phone's too smart for you.
You're right.
In Melbourne, Taz is venting to his partner Amanda. He just can't seem to work out his new phone.
I texted my friend, can I use your Wi-Fi? And it's auto-corrected to wife.
Can I use your wife? Can I use your wife? I mean Wi-Fi. That's totally what I meant.
I know. I said, look, I'm sorry. Yes.
How do you backpedal from that?
Yeah, I was so embarrassed.
I would be too. Oh, that's so good. Oh, there it is.
But the laughs are over when an emergency call comes through.
RC139. It's just a case number 10627. Just looking at the history, we'll be upgrading on a 1 to this one.
Roger, code 1, that's fine.
So, Amanda, I think this female, she's 52.
Yep.
She's collapsed.
Yep.
She's vomiting.
Yep.
But at the same time, she's got a history of brain bleed.
Given the woman's history, Taz is worried she could be having a stroke.
Look at this traffic. The whole way down.
Oh, he's gonna break. Bleeding in the brain is one of the most serious emergency you can think of. Every minute counts. No, go up. This is easy.
Over this?
Yeah. It's easy. Easy. Oh. Sorry. First time you've done a four-wheel driving?
In an ambulance, it is.
Taz and Amanda have made it in good time, but they need to act quickly. Nearly half of all brain bleeds end in death.
G'day. She's your... what's her name? Donna.
Donna, a foster mum with 3 children,
Hello.
appears to be in serious trouble.
Oh, okay.
Hello, Donna. I'm Taz here.
My head's gonna blow up.
So it looks like he was about to have another seizure there. His pupils dilated and he's just become a bit stiff. So I'll give him some more medication now just to make sure he's nice and comfortable.
In country Victoria, Flight paramedic Matt is worried Logan could have suffered a serious head injury. The 14-year-old schoolboy crashed onto the floor during high jump practice and went into violent convulsions.
All right, Logan, just relax, mate. Just relax, mate.
Logan's mum, Fiona, has just arrived to find her son heavily sedated.
Okay, buddy. Okay, buddy.
On his head now, okay?
Just relax, buddy.
Dad Chris, a teacher at the school, has not left his son's side and is fearing the worst.
It was very distressing. He was having really aggressive fits and seizures and trying to roll over and sit up and stand up.
All good? Okay, buddy.
Yeah, he wasn't responding. Never seen him like that before.
Logan needs to be airlifted to hospital urgently, but to be moved safely, he has to be put into a medically induced coma.
Have we got the ketamine drawn up? Can I have the ketamine, please?
Come on, buddy.
Can we grab a blanket or maybe that pillow, please? We need to lift up his shoulders and support his head and just get this underneath him. Any intubation is an invasive, dangerous procedure. I'm going to stop him breathing and put him to sleep effectively and take control of his breathing. So is everybody pretty much ready? So I'll give him some medicine in a moment, which will make him really sleepy, and then I'll put that tube into his airway and we'll take over his breathing from that point. All right, so let's go with some drugs, please. Everybody ready? And you're on the suction. You're ready to go. Cheers.
Which relax, you've been looked after.
Suction, John.
A failed intubation can starve the brain of oxygen and cause cardiac arrest.
You understand what's going to happen?
Yeah. I'm still scared about the unknown and what the outcome would be. It would be the worst day of my life, without a question.
That's a drug one here.
That's 99%, heart rate 120.
To take over Logan's breathing and put him into a medically induced coma, Matt needs to carefully place a tube down Logan's throat.
Can you just push on the gastric tube from this end? Just gentle push down.
Just rise and equal.
There's a
left and
waveform, got misting of the tube, got good rise and fall, and we've got end tidal. That's great, I'll give you that.
The intubation has worked, but the long wait to see if Logan's brain will recover is just beginning.
Yep, that's great. Wonderful, that's terrific. So we'll just transfer him across onto our bed. We'll keep him nice and comfortable. He's going to sleep the whole way until we get him to hospital.
Dad Chris will travel with Logan in the helicopter, while Mum Fiona will go by road.
Ready, set, and go. So we're flying back into the Royal Children's Hospital, and I want to give the parents as much support and reassurance as possible, but I can't say exactly what's wrong with Logan at this point. I'm still concerned that he does have a brain injury.
Yeah, I was worried that is he actually going to regain consciousness? Is he going to make a full recovery? All the things you expect to do as a father and son, may not be able to be done in the future.
Look after yourself, buddy.
Yep.
Donna?
My head's gonna blow up.
In Melbourne's western suburbs, Amanda and Taz are also dealing with a confronting medical emergency. With Donna's history of brain bleeds, they're worried the foster mum could be having a potentially life-threatening stroke.
When did this start, Donna?
Half an hour ago.
Half an hour ago.
To walk in and find Donna in this much pain, I'm worried. Is she having a bleed and is it getting worse?
Have you taken anything for the pain, darling? Aspirin.
Out of all of the pain relief options she's got, she's chosen the worst one. Aspirin thins your blood, and if she's already bleeding, this is going to make this worse.
Either you can sit or you can lie,
down.
whatever is
Perfect.
comfortable.
Yeah, beautiful.
Hmm.
I'm sorry. No, don't apologise.
No, can I look into your eyes then? Open your eyes.
Taz quickly checks Donna for the telltale signs of a stroke.
Can you squeeze my fingers, please? The other hand? Other hand also?
In our stroke assessment, we need to ensure that the patient's got strong grip strength, whether or not they're suffering on one side more than the other, whether or not they're able to talk, whether there's any slurring or drooping of the face. At this point, other than Donna's pain, she's not showing any clear signs of having a stroke.
But that doesn't mean the foster mum is out of danger.
Oh, my head. I'm just about to give you some spray up the nose, okay? And that should help a little bit with the pain. Ready? Yeah. 1, 2, 3, 4. Okay?
Good. Donna, what other medical history you've got?
Migraine.
How often do you get migraine?
2 to 3 times a week now.
2 to 3 times a week.
It's knocking me around, so I'm shocking.
Does it feel like it's another one of the migraine?
This feels worse.
It feels worse.
A migraine's not just a bad headache. They are absolutely horrendous and they can affect you for days. I suffer from migraines and I know that pain. All I want to do is make this woman more comfortable.
You're all right. One big move to the stretcher and then that'll be it,
Got
okay?
medications ready.
That's it. Good girl.
In case.
At this point, we can't ascertain whether or not Donna's having a migraine or a bleed. Every second counts. This woman needs to get to hospital ASAP.
Good to go?
Yeah.
Okay, we're clear to come in there, guys.
Flight paramedic Matt is getting ready to emergency airlift Logan to the Royal Children's Hospital. The schoolboy has a suspected brain injury and has been put into an induced coma.
Happy to go whenever you're ready, mate.
Dad Chris has been watching the nightmare unfold.
Logan's dad seems quite controlled, but I know inside him he would be torn up and very distressed. It's a horrible experience for any parent to have to go through.
Everybody securing the back doors are locked, thanks. Roger, mate. Take the briefing.
Yeah, Logan loves his footy, but he's a complete cricket nut. So to see him potentially not be able to play sport in the future would leave a big hole in his life.
Let's see what the scan says. Hopefully, just a knock on the head, he's got a bit of concussion, but got a cricket grand final on Sunday. Oh, has he? Which got delayed from last Sunday. Righto. Good afternoon, helicopter ambulance 1, inbound to the Royal Children's Hospital medevac, requesting airway clearance.
At hospital, Logan will be kept in a coma until his condition stabilises. But there are no guarantees he'll ever play sport again.
So in terms of outcomes, you'd just be guessing at this stage? Well, seizure activity that he has concerns me that something's gone on inside his head, so we get the scan of his head when we get to the Royal Children's Hospital. But ultimately, it's just now boils down to working out where we're at.
You have to use your words very carefully because you never know what the final outcome will be. I don't want to give Chris false hope that everything is going to be perfectly normal when they take Logan into a CT scan and it shows that he's got a significant head injury.
Logan will now be rushed to the emergency department where doctors will assess if the 14-year-old has suffered any permanent brain damage.
As I was walking across that helipad, all the potential bad outcomes, the worst case scenarios were buzzing through my head, whether he'd, be able to function as a normal person in the future. Am I going to have to feed my son with a spoon for the rest of his life?
Watch this truck not move. That's in the emergency lane.
Taz and Amanda are desperately trying to get Donna to hospital. They don't know if the foster mum's agonising pain is a severe migraine or a life-threatening bleed to the brain.
How long you been suffering from migraine? Oh, so from very young age. Okay. Donna, may give you some oxygen, okay?
The pain relief's finally kicking in and Donna has calmed down.
Feel better now? Yeah, you look comfortable now. That's good. That's good. It's a big difference from the time we came into your room when you were upside down. At least you can relax now. Good. That's all right. We just want to make sure that you feel better and you get better soon. I hope Donna gets better as early as possible. Being a foster parent, I think there's a lot of people rely on her. It is a very demanding, it is a very challenging job.
Specialists at the Royal Melbourne Hospital are waiting to give Donna an MRI scan. If a bleed is found, her life is still in danger. As night falls across Melbourne, good mates Leonard and Nat are just starting work.
Yeah, it's nice. I feel like a teenager again. I do. I mean, because of my new guy.
Yeah.
Like honeymoon phase, you know, when you meet someone and you're all loved up and it's all exciting.
How much do I know about Natalie's love life? A fair bit now. I mean, there was a period where she was trying Jewish Tinder.
Oh, hello.
What are you doing?
I'm on J-Swipe.
Give me a look.
What do you think? Yes?
No,
gone.
I don't like it.
Right, gone.
I don't like to admit it, but I had a blast doing J-Swipe with her.
No, swipe left.
I don't think that was overly successful. But hey, she's found a pretty good guy, I think. Not on J-Swipe. I think she found him the normal way.
He may not be Jewish, but he slotted right in. You would mistake him for being Jewish. I mean, he's Jewish from the waist down, so does that count?
But it's back to business as the team is called Lights and Sirens Code 1 to a potential heart attack.
715 received, code 1. So, Leonard, the only information we have is that we're going to a 65-year-old male with chest pain. They're no longer on the phone with this patient. We don't know what the cause of the chest pain is. We don't know what his past history is.
We prepare for the worst, expect the best, is what we like to say. And I think anyone that calls an ambulance with chest pain, we need to take it very seriously.
Hi, I'm Natalie.
Hi, I'm Harriet.
Hi, Harriet.
Come on through.
Where am I off to?
Straight and left.
Hi. Hi. What's your name?
Warren.
Hi, Warren.
Warren and wife Harriet were enjoying their traditional Jewish Friday night Shabbat dinner when his left arm started aching.
He was going, oh my God, it's so sore, and he was feeling pain.
So it was quite severe when it happened?
No pain. I don't feel any pain at all, except for the discomfort of where it is. It aches.
Okay.
While Warren is playing his symptoms down, Nat's not buying it.
It feels muscular, like I've strained myself by lifting or pushing.
So when you move that arm around at the moment, does that change that feeling of discomfort at all?
Nothing really. It's just that a little bit heavy.
Just a bit heavy?
Yeah.
Although Warren's looking pretty relaxed, I think Harriet's telling me the real story. Heart attacks are very sneaky buggers. People assume that they will feel central crushing chest pain. People describe it as though an elephant sitting on their chest, but it's so often not the case. Warren may be having a heart attack tonight.
Emergency services.
There's been a hit and run. It was two cars. There's like one car side-swapped another.
Okay.
At Melbourne's Emergency Communication Centre, an eyewitness to a shocking car crash is on the line.
It was pretty bad. He went across 3 lanes and just went over the curb and into the back of trees and houses.
Do you know if there's anyone injured?
I hadn't stopped. I'm about probably a K from him.
The car that went into the trees, how many people were in it?
I don't know. It was a small car. I've seen him in the rear mirror. He's gone flying.
Intensive care specialist Cullen's on his way to the accident on the busy Nepean Highway. He's taking the shortest route possible.
One of the great things about Melbourne is that we have tram tracks, which allows emergency services to get through a lot of heavy traffic.
As he arrives, all Cullen knows is the hit-and-run victim has slammed into a tree.
I'm yet to see how significant that impact was.
but the car always comes out second best when it hits a tree.
Group 1 patient who's currently trapped by his leg.
99 receiving. When I first see the car, my worst fears are realised. The driver's door is wrapped around the tree. How can anyone survive this? This is a massive impact.
All right, mate. We're going to a 55-year-old female who's fallen from her bicycle and injured her wrist.
Mike and Eamon have been called to a cyclist in trouble in a popular Bayside suburb.
Most important thing you're going to be asked all day, what's this lady's name? What is this lady's name? A 55-year-old female cyclist. Her name is going to be Helen.
Guessing patients' names is an Eamon game. I've never done it before, but I love it. It's always a bit of fun, and it just helps with that relationship between us. Really makes us work well.
I'm going to go with Sarah. There's a lot of Sarahs out there.
There is. I'm just playing a numbers game now, mate.
We've got to get one day.
I've got someone pointing. Oh, yeah, here we go.
So first thing we always ask, what's your name? And if I get it wrong, it's a little bit of heartbreak. Hello, what was your name?
Not a Sarah and not a Helen, as Eamon guessed. With the name game, we never get it right. That's part of the fun.
Diane, don't you worry. My name's Eamon. I've got Mike with me.
Diane and her friend Jamie were on their way to buy cat food when her bike got stuck in a tram track and she crashed to the ground.
I skidded.
All right, deep breath, deep breath.
I don't usually like to fast.
Okay, don't stress.
The tram track just caught me.
We so often go to patients who get their wheels stuck in the tram tracks, and as soon as that wheel goes in there, it's game over for them. So tell me, where are you sore?
My hand's getting really angry.
Your hand's giving you grief. Okay, can you wiggle those fingers for me?
I don't really want to.
You don't want to do that. That's fine. No, I'm not going to make you do that, okay? It's all right. You take a deep breath. Diane.
During the fall, Diane's head was protected by a helmet, but she could have injured her back or spine.
You're not sore anywhere else, not in your legs or anything. You're able to walk after that. You didn't knock yourself out in the process. Okay.
I'm sorry.
That's okay. All right.
Assessing the highly emotional patient is turning out to be tricky. Eamon needs to calm her down.
It's a really easy trap to fall into, to go, oh, she's just a bit anxious or she's just a bit upset, and therefore miss a really serious injury. But it's impossible to assess someone who's really distressed. So that's why the first thing that we always want to do is rest and reassure that person.
Take a deep breath, all right? We're going to take very good care of you, all right? I promise.
Warren, what we'll do is we'll check you out, head to toe. We'll get all your vital signs.
In a nearby suburb, Nat and Leonard are worried 65-year-old Warren is still having a heart attack.
What have you had in the
I've had a
past?
stent.
Yes.
Before.
See, have you ever had chest pain before?
I've had,
Or a heart attack?
I haven't had a heart attack.
Okay.
Warren is not worried about his symptoms, but wife Harriet is sure something sinister is going on.
Concern is because he's diabetic, he's been told that diabetics don't feel the pain.
They can have silent heart attacks.
Correct.
Being a diabetic changes everything. Diabetics can have what we call silent heart attacks. So they have a heart attack with some of the symptoms, but not necessarily pain.
Right.
65, did you say?
Yeah.
Leonard's now tracing Warren's heart rhythm for signs of trouble.
Okay.
Nice and still
so
for a
arms
second.
down, normal breathing for us.
All right.
You check your sugar all the time, do you?
Yeah, lately it's been very hard.
Has it?
Because he has diabetes, Warren is twice as likely to suffer cardiac problems and is a prime candidate for a deadly heart attack.
So it looks fine. The sinus rhythm
Is that what it's saying?
looks fine.
Okay.
I perform a 12-lead ECG and it comes back as normal, but it doesn't mean he's in the clear.
So the good news is we can't find anything wrong. The bad news is I do think any sort of left shoulder, arm, chest pain without explanation should be investigated at hospital.
Yeah.
Okay, let's go. Lovely to meet you.
You too, good Shabbos.
You too, good Shabbos.
You want some malaga while you're here?
I love
Piece
some.
of challah?
I love some colour.
Of course, Harriet is trying to feed me. I mean, it is Friday night Shabbat dinner. That is what we do. We eat. She's offering me challah. It is this sweet, soft egg loaf. You can't get anything better.
I'll get you to step on in.
But considering all the risk factors Warren has, I want to get him into the ambulance and off to hospital.
Did he get some of that challah?
No, I didn't. Hurry up, Brenda, bring this in.
She's not coming.
I know. Just call it. Bring the colour.
It's great that Warren's pain-free at the moment and everything's stable, but there's nothing to say that that chest pain won't come back or that he may deteriorate in front of me. He's not out of the woods yet.
We're good to go.
Back on the busy Nepean Highway, intensive care paramedic Cullen has arrived at the scene of an horrific hit and run. As he approaches the trapped driver, he has no idea just how severe the injuries will be.
Okay, mate, how you going? My name's Cullen. I'm from the ambulance. Have you got much pain in your legs?
Yeah.
Pain in your hips? Can you move your feet?
I can't move it like that, yeah.
Yeah.
He's fully, the door's fully on his...
Yeah, sure.
28-year-old Abdul has been sideswiped off the road.
Do you have pain in your leg here or leg down there?
Yeah.
You do? All right.
He's still trapped from his waist down by the car. I'm trying to see what his injuries are at the moment, and we won't be able to fully assess those until we get him out of the car.
How old are you, mate?
I'm fine.
Sorry?
I'm fine.
How old are you?
I'm fine.
As I'm looking in the car, it's dark, but I can see that Abdul is a bit confused, which makes me suspicious that he has sustained a head injury.
So what we're going to do, we're going to put a needle in your arm. We're going to give you a little bit of pain relief to get you out of the car. We're going to rely on heavy rescue to actually chop out some of this car before we can extricate you, all right?
Just about through on this side.
Have you got access to his legs over there yet? Yeah. Yeah, would it interfere with you guys if I came around and actually inspected his legs and pelvis? Have you got pain on your hips in here? If I push in there? No, what about your tummy? Any pain in your tummy? No? All right.
If Abdul has internal injuries, he could be bleeding out.
From looking at the cabin intrusion and the impact that the tree has had on Abdul's car, there's a really good chance that he's got a fractured pelvis or broken pelvis and broken upper legs. Both these injuries can be potentially life-threatening.
Diane, what are you so upset about, Diane?
It's getting late, and Eamon is still trying to pacify the traumatised Diane. She was heading to the shops for cat food when her bike got jammed in tram tracks and she crashed to the ground.
It's hurting. All right, that's what we're going to get sorted right now, all right?
Reassuring patients, it's the cornerstone of what we do. Once we've calmed a patient down, that's when we start to get a real understanding of what's actually wrong.
So this medication's called fentanyl. It's a couple of... How old are you, I'm sorry?
I'm 55.
No worries. I'm going to give you a couple of squirts up each nostril.
21.
21. That's what I was thinking. And then once we get in the ambulance, we'll look at maybe putting a needle in your arm to give you something a bit further for the pain, OK?
With Eamon's charms and the pain relief working their magic,
1, 2.
treatment of Diane's injuries can finally start.
Pardon me, I'm going to sneak in there beside you.
This is Diane, I don't know.
Oh, hey, Diane. Sorry, I'm Mike.
You look like you've done a couple of rounds with Mike Tyson.
Really?
Yeah, you've still got your ear, though. Was he the ear biter?
I think so, yeah.
Yeah, right. So this won't be tight.
Diane's badly injured wrist may not be her only problem. Eamon still needs to rule out a spinal injury.
You're not sorry anywhere else, not in your legs or anything. You're able to walk after that. You did knock yourself out in the process.
No, I didn't want to into this.
Oh,
I
no, that's
can't take the
understandable.
bone.
Yeah.
Fortunately for Diane, she doesn't seem to have any tenderness. She hasn't got any sort of altered sensation in her fingers, so I don't have any major concerns for Diane's spine at this stage.
Where do I sit on the thingy?
Yeah, you sit on the bed for me, all right? How's your pain at the moment?
Oh, yeah, when I do that, when I move that, it's really bad.
Where's that, Zora? And you're at wrist there. Yeah.
Diane will be fully checked out at hospital, but tonight's trauma is taking its toll.
Diane.
Play the guitar, what am I going to do?
Diane. Diane.
I'm pretty good with pain usually, but this is really bad.
Poor Diane, she's a bit of an emotional roller coaster.
Here you go, tissues.
Just when Mike and I think we've got her reassured and calm, and then she gets upset all over again. So we have to just let her know that everything's going to be okay and wait for some of that pain relief to kick in as well. She's going to live, but it's going to suck for the next little while.
Diane, look at me, look at me, look at me.
You shouldn't have this much chips. Sorry.
Nat and Leonard are on their way to hospital with a much calmer patient. They're worried diabetic sufferer Warren could be having a heart attack.
You sending emails?
No, not at all.
No?
I'll find you something.
Okay.
There you go. That's the Baker IDI.
Yep.
But the 65-year-old's so stoic, he's more interested in showing off his profile on a Diabetes Institute website.
Looks can be deceiving. Warren lives with type 2 diabetes, heart disease, yet despite his countless doctor and specialist appointments, he is a ticking time bomb. That doesn't sound very promising. You're a ticking time bomb.
Warren's pretty proud of the fact that he's the poster boy for the Diabetes Institute. I don't know if it's such a good thing.
This bomb is not going off tonight, that's for sure.
It's great that Warren's stable at the moment. He's pain-free, he's smiling, he's laughing, but at the back of my mind, I know that I need to make sure I continue to assess him in case anything changes.
I know I'm not the fittest guy on the planet, but years ago I used to be a weightlifter.
Did you?
You know what a clean and jerk is?
Clean and jerk. Clean and jerk. I assume he's talking about weightlifting. Yeah? Yeah. Let's go with it.
Lift to here,
Yes?
then up,
Okay, so lift to there.
and then up.
That's called a clean and jerk. Clean and jerk. Have you heard of that, Leonard?
I have.
Oh, you have? Okay.
But despite the banter, Nat remains concerned that her ticking time bomb patient could still go off.
As much fun as I've had chatting to Warren, at the end of the day, he's had an episode of severe chest pain. I'm really glad to get him to hospital where he can be provided with definitive care. He needs an ECG done, he needs blood tests, potentially an X-ray. He could be really sick.
Okay, we'll take you on in, Warren. You comfortable?
Yeah, I'm fine.
Warren thinks he's fine, but cardiologists will decide whether the former weightlifter needs immediate life-saving surgery.
How's the pain, mate?
Just a few kilometres away at the scene of a terrifying car crash, Cullen's trying to find out if the victim's legs have been crushed.
Can you feel me touching you there? That feels normal. What about there?
28-year-old Abdul left his family behind in Pakistan to study in Melbourne. Tonight, he's lucky to be alive.
We don't know the full extent of his injuries yet, and we won't be able to fully assess those until we get him to hospital safely. But I can see some blood coming out of his ears, which isn't a good sign. All right, let us know if there's any pain anywhere at any time.
Abdul's flatmate Fez started worrying when his best friend didn't come home.
It was a terrible night. He wasn't answering my calls at all, nor replying to my messages. I was really, really worried. He's like my brother.
We're going to bring a board in from this, put it underneath your bottom. We don't want you to help us. Then we're going to pull you out and manually stabilise your head while we get you onto the board, okay?
Cullen's worried Abdul could have suffered a fractured pelvis or potential spinal injuries.
When you have internal bleeding, every second counts. If we're delayed in any way, it could have significant consequences. We need to get him safely out of that car and get moving. Yeah, put the board under his legs there. Mark, are you able to... Hang on, don't help us, don't help us, don't help us, don't help us. Stay there, mate. Can you straighten your legs? All right. Shuffle up. Have you guys got the board up that end? Lie down. All right. Can you put the pelvic binder on? Whilst we're extricating Abdul from the car, we need to be really careful that we don't injure him further. So we need to treat him as if he does have a spinal injury until he gets x-rayed at hospital.
On go, we're going to just lift and stand up. Is everyone ready? Yep. Ready, set, go. All right, so we'll walk either side of the bed. It's nice and still. Don't move unless we ask you to, okay? Yep, all right, we're going to get you in the ambulance now.
Abdul's being rushed to the Alfred Hospital Trauma Centre while rescue teams work to clear and reopen the highway.
Abdul, can you wiggle your toes for me? Can you wiggle your toes? Once I get Abdul into the ambulance, to my amazement, he's sustained no significant lower limb injuries that I can see at this point in time. Push back up. But it's the injuries that I can't see that I'm worried about. All right, we're just arriving at the Alfred now. Abdul, all right?
At the emergency department, if scans confirm internal bleeding, Abdul will be taken straight into emergency surgery.
I can't help but think that Abdul's been hit by another car that didn't stop to render any assistance. He's done nothing wrong, and one simple act can potentially change his life forever. Trauma 2.
You shouldn't hurt this much. You shouldn't.
In Melbourne's Bayside, Eamon and Mike are trying to calm down Diane. She was on her way to the shops with her friend Jamie to get cat food when she came off her push bike and badly injured her wrist.
I'll pop a little needle on your arm and
Did you get the cat food?
That's all right, he's getting everything.
Did you get the cat food?
Diane, you stop worrying about everything else, okay? I can see you stressing about everything else. You're the main focus now. The cat food will get sorted. I know you're upset. I know it's stressful when this happens, but you're okay, all right? You're in very safe hands with us.
So pretty.
I'm going to pop a little needle on your arm and get that pain under control.
Did she just call him pretty? I definitely would not refer to Eamon as pretty. Pretty average looking, maybe.
Let us get you to the right place and everything will be okay, all right? You've got a very good paramedic here looking after you. I'm not talking about myself, I'm talking about this guy.
The boys now need to keep Diane distracted so they can give her a needle for her pain.
So what sort of cat have you got, Diane?
He's an Egyptian water cat.
An Egyptian water cat?
He was a rescue cat. He was 3 weeks old.
Sharp little scratch.
You're an adoptive cat mum then. What's his name?
Munch.
Munch.
Because he eats like a pig.
I'm a big fan of Munch. Munch is the best form of pain relief I've got right now. Thank you, Munch.
With Diane pain-free at last, they can make their way to the nearest emergency department with a much more relaxed and very grateful patient.
I always feel my #1 heroes because you always help everybody. Your life and death, or life and care.
Word is officially in from Diane. We're #1 on her hero list. Diane is well on her way to being my all-time favourite patient ever.
Oh, we're here.
We're here. He's an efficient driver, Mike.
It's good. Thanks, Mike.
Oh, you're very welcome. The trick is not to stop for red lights.
Diane's had some pain relief. She's had a bit of a flirt. She's talked about her cat. Now it's time for her to get some x-rays and get this arm sorted.
The triage nurse is a good friend of mine, so make sure you give her a hard time.
Get.
It's now 12 weeks since overseas student Abdul crashed into a tree, but he's back on his feet, playing his favourite sport with best friend Fez.
Hang on, don't help us, don't help us, don't help us, don't help us. Stay there, mate.
On the night of the accident, Cullen was worried Abdul had crushed his legs and could have devastating internal bleeding.
I was in hospital for 6 days, and it took me 2 to 3 months to recover fully. If you go to Windows.
Abdul did suffer a fractured pelvis and jaw, a broken collarbone, and a brain hemorrhage, but has fully recovered and is back at uni finishing his IT course.
The other driver, he called me after the accident, and now he is a good friend of mine. I'm so grateful to have another chance again. One more chance to live this life. Yeah, I feel so lucky.
Please, get up, Mama.
Foster mum Donna is also recovering from her ordeal. After a couple of nights in hospital, a stroke was ruled out, and she's now being treated for chronic migraines.
Can you wiggle those fingers for me?
I don't really want to.
You don't want to do that. That's fine. No, I'm not going to make you do that, okay? Diane.
It's been 2 months since Diane fell off her bike after she got stuck in tram tracks while out buying cat food.
So what sort of cat have you got, Diane?
Was it?
He's an Egyptian water
An Egyptian water cat?
Eamon's charms kept her calm, but Diane's wrist was broken. After surgery, doctors sent her home to recover with rescue cat Munch.
Meow. Munchy, munchy. But I can still ride. I'm very cautious because I need this hand. I write, I draw, I do all those things. So I'm listening to everything they told me and doing the right thing. I mean, your body's a temple. It's a temple. You've got to take care of the temple. In my mouth.
I don't feel any pain at all.
Nat and Leonard were worried that diabetic poster boy Warren was having a heart attack.
He's been told that diabetics don't feel the pain.
They can have silent heart attacks.
Correct.
And they were absolutely right. Shortly after being taken to hospital, Warren had a cardiac arrest and nearly died. He had 3 stents fitted and will never be blasé about the warning signs ever again. And it's now 3 months since Logan was airlifted to hospital with a suspected brain injury after he crashed to the floor during high jump practice.
They took him for scans quite quickly, and within possibly about 40 minutes to an hour, I got the news that there was no damage to his skull, no damage to his spine, and no damage to his brain. It took me a little while to actually process the news that it was good news, but it was amazing.
You get tired?
Nah, not yet, mate. Not yet.
Logan's only just started playing sport again and did miss the big event he'd been looking forward to.
I missed a cricket grand final, which was 3 days after I hurt myself, and we lost by 30 runs. That was really disappointing.
Life can be fragile, but at the same time, don't wrap yourself in cotton wool. Make sure each day counts and take on all the adventures and the things that life has in front of you. So, yeah, it's a great reminder how precious life is.
Go ahead, caller. So tell me exactly what happened.
I just was up the road from my mum and she had a bad headache.
Okay.
So I've come down and now she's unconscious but breathing really funny and the eyes rolled back in her head.
At the Melbourne Emergency Communications Centre, a terrified daughter is on the line. Her 64-year-old mother, Vicky, has suddenly collapsed.
Now, is she awake?
No.
Is she breathing?
Well, she's making funny noises, like gurgling.
Gurgling. All right, we're going to get her some help, okay? So stay on the line. I'll tell you exactly what to do next.
Flight paramedic Ray and an air ambulance team are heading to the critically ill patient 70 kilometres away.
Set off takeoff. It's good from left. And good in the back.
A local Micah team from the Geelong area are also on the way.
And clear right, turning right. Roger.
For more reports, this lady is normally well, but today has developed these shocking headaches. We're suspicious immediately this patient probably has had a stroke. A bad stroke will kill you, and the mortality rate is quite high for severe strokes.
The road paramedics are now only minutes away from the patient.
All right, she's unconscious and making those funny noises, so we're going to start CPR, okay?
Emergency services are trying to help Vicky's daughter, Nicole.
I just don't know how I'm going to get her off. I didn't have a chair.
So if she's on the chair there, just grab her by the ankles and slide her off the chair onto the floor. Don't worry about the fall. We need to help her now. Let me know when she's on her back, okay?
Oh, God. Sorry, Mummy.
No, I'm just going Corroy Creek Road to Laverton.
Corroy. That's like one of my favourite street names.
Corroy?
Corroy Creek Road.
In Melbourne's west, best mates Risky and Nicola are between cases, but finding ways to amuse themselves.
Try saying that 5 times fast.
Corroy Creek Road, Corroy Creek Road, Corroy Creek. No, I'm not even.
Need any Mac 3?
Nah. When you spend a lot of time with someone in the ambulance, you find yourself talking about some strange things sometimes. Can you do it?
Corroy Creek Road, Corroy Creek Road, Corroy Creek Road, Corroy Creek Road, Corroy Creek Road.
You look really happy with yourself.
Corroy Creek Road. Maybe you should add that into your stroke assessment. Get them to say Corroy Creek Road 5 times.
Life's fun on the road with Nicola. She takes the mickey out of me a fair bit, but that's what I love about her. You need those kind of people in your life.
But the banter's over with a call out to an elderly patient.
So we're on our way to an 89-year-old female complaining of a headache. This could be as simple as just your standard headache, but it could be something really serious, like a cerebral hemorrhage or a massive stroke. Hello, ambulance. How are ya? Who are we here to see?
Maria.
Maria. Hi, Maria. My name's Nicola. This is Michelle here. So what's happening today?
I get shivery.
Get shivery?
Yeah.
Yep.
And headache.
Headache?
All my bones, all my belly.
Yep.
Cheek.
Yep.
Great-grandmother Maria lives with her daughter and son. They've never seen their stoic mum in this much pain.
It's very unusual for my mum. She's still a tough old girl, and if she's laying in bed and she can't get up, there's something wrong. Totally out of character for mum.
Emergency services. Tell me exactly what happened.
There's been a big car accident in front of us.
How many cars involved?
2.
First job of the day for flight paramedic Matt is a high-impact car collision at Phillip Island, 80 k's southeast of Melbourne.
How many people are hurt?
Oh, there's quite a few. There's kids.
Is anyone trapped?
Yes.
So just down the line, I'll tell you exactly what to do next.
It's 2 patients, from what we can gather at this stage, a female in her 50s and a young child of 11 years of age. From reports, both of them sound as though they've got chest injuries.
That's where it is, right there.
Approaching the scene, you can see it's a large scene. There's multiple cars already on site, lots of emergency vehicles. And my immediate thoughts are about getting around and assessing the patients that are at scene and working out who is the sickest.
Taylor's clear of the power lines in the back on the left. Roger, come down just position. Fluid in his hand on the left. 3, 2, and 1. Clear on left.
Matt's taken immediately to witness the crash scene. A 56-year-old woman and her 2 granddaughters have been freed from the wreckage of the white sedan. It's miraculous that no one has been killed in this horror smash.
No brakes on this lady's part. So this is the cabin intrusion.
Yeah.
So airbag hasn't deployed.
Yep.
So we're querying at lung contusion.
Sure. When I actually look at the accident, I can see there's been significant force and major intrusion to the side of the vehicle. Immediately, I think about where people sit as the accident occurs, and I think about the forces that are transmitted through those vehicles and how they will affect the actual patient. So I'm very concerned that these patients are going to have significant injuries.
All right, now listen carefully and I'll tell you how to do resuscitation. Place the heel of your hand on the breastbone in the centre of the chest, right between the nipples.
Back at the Emergency Communication Centre, a call taker is giving CPR instructions to a distraught daughter. Nicole's 64-year-old mother, Vicky, appears to have had a devastating stroke.
So I want you to pump the chest hard and fast, at least twice per second and 5 centimetres deep. We're going to let the chest go all the way up between pumps and we're going to do it 600 times or until help can take over.
20 minutes, Ray? Sure.
Flight paramedic Ray and the air ambulance team are on their way to Geelong to airlift the critically ill Vicky back to the city.
The mechanics of CPR is quite brutal. You are pressing on chest really hard, really fast. You can break ribs. And doing that on someone you love, waiting for the ambulance to arrive, must be the most traumatic thing in the world.
So I want you to count out loud so I can count with you. I want you to start pumping the chest. 1, 2, 3, 4. 1, 2, 3, 4. All right, keep going until help comes. 1, 2, 3, 4.
With the air ambulance still en route, the Micah Road team has now reached Vicky's house.
Strokes are one of the most time-critical events we can have. Like heart attacks, time is tissue. In this particular case, time are brain cells.
Within a few minutes, the intensive care specialists have put Vicky into an induced coma. They're now heading to the local football oval to meet up with the helicopter.
They haven't sort of indicated where the good vehicle access is, although what's this off to the forward right? Spare gate.
Personally, I find the thought of a stroke probably the most confronting thing that would happen to me.
Okay, clear doors, guys. Yeah, left looks fine.
Something that takes away your brain and your personality and your ability to think, your ability to act and to interact with people. To me, that's by far the most devastating thing that could happen to you.
Basic story today, a severe headache, like she's been hit to the back of the head with a baseball bat. Then she's collapsed to the ground, agonal breathing, and daughter started CPR for a brief period of time. So definitely something neurological going, there's no doubt about that. So we've elected to RSI her under the non-traumatic brain injury guidelines.
Yep, nice job. You've got nothing to do. Let's put her on a ventilator and go.
To save Vicky's life, Ray urgently needs to get the 64-year-old to a neurosurgeon at the Royal Melbourne Hospital.
So are we all happy with this unusual plan of putting her on the board and popping her over the top?
But there's a problem. The gate at the Oval is locked.
Yeah, so feet first.
And they'll have to lift Vicky over onto the helicopter stretcher.
Okay, we're happy. We're just going to get a few people over this side of the fence. The action of moving someone across the gate basically exposes us to losing the intubation tube, losing all that plumbing, so our IVs, it could potentially dislodge equipment, which is essential for us to monitor her very health. Let's just stop there for a second. Just got one seatbelt to do. So you've got a tube going down into her lungs and we're controlling her breathing. Basically, we're breathing for her. If we lose that tube, we lose that ability to breathe for her and she could potentially die.
Just need one more person up that end.
Do you have pain?
My head.
So you still have the headache now?
Meanwhile, Nicola and Risky are still trying to work out if their patient, great-grandmother Maria, has also suffered a stroke. Son George is alarmed at his mother's symptoms.
The big thing was that she had a severe headache, and that was concerning because she doesn't really suffer from headaches.
Feel hot, feel cold.
Feel hot, feel cold?
And all the heads are everywhere.
And you feel tired?
Yeah.
After Maria tells me a little bit about what's been going on, the first things I need to tick off are check her blood pressure, her heart rate, her temperature, and just see if we can get a better picture of exactly what's happening here.
Yeah, 38.3.
You've got a temperature. So how about when you go to the toilet for wee? Has that been normal?
Oh, I have plenty of wheeze.
Lots of wheeze?
Yeah.
More than normal or?
More.
Okay. I was thinking maybe a urine infection, but can't be certain.
Urinary tract infections, or UTIs, are common in the elderly. But if they're not treated, they can cause permanent kidney damage and even fatal septic shock.
I never have in my life.
Never?
Never.
Maybe this
First
is the
time for
first
everything,
time.
isn't there?
Despite feeling so unwell, the brave Maria is more worried that her English isn't good enough.
In somebody else in Australia, we should speak better.
Oh, your English is good.
I have English friends.
Okay.
And said to me, you want to learn English?
Yeah.
And teach me.
I only know one word in Greek.
What?
Ponos or ponoi?
Ponas.
Ponas, yeah.
Ponas.
Pain.
Yes.
Yep. We'll get you sitting on the edge of the bed. I want to see how you go sitting up here. Give you a hand. Despite the fact that Maria has a headache, I'm confident that she's not having a stroke because she's able to talk normally, her face isn't droopy, she can move all her limbs. But she could have a urinary tract infection and that could still be serious for someone her age. All right, let's get you onto the bed.
If you don't think you can do it, just let us know.
We need to get Maria into the ambulance and get her off to hospital as soon as we can to get further tests.
If you feel dizzy, you let me know, okay?
Back in Phillip Island, flight paramedic Matt's about to get his first look at the victims of an horrific road accident.
I'll just jump in and have a quick chat. Hi there, how you going?
In the white sedan was a grandma and her two granddaughters. One of the girls, Zara, is already on her way to hospital. Matt's about to assess the other granddaughter.
What was your name?
Sophie.
Sophie, my name's Matt. Can I just get you to relax your teddy just for a little bit, please? Now, how old are you?
11.
11. My daughter's 11 as well.
Assessing Sophie, it's hard not to feel a connection and feel some emotion. You know, I can't help but look at her lying on the bed and, you know, wonder if that was my daughter, how would I be feeling and how would I be reacting?
So this is going to be really quick. There's no pain, but it just feels cold with what I'm about to do, okay? Take a big breath for me.
Matt's using ultrasound to check for any internal injuries.
And another big breath for me. I'm happy with that. I'll let you take Sophie off to hospital.
You want to hold on to this bloke again?
We'll leave you to it.
So Sophie looks as though she's in the clear, which is fantastic, but my main concern now is her grandmother, who appears to have sustained the full force of the impact from the accident.
Hello, how you going?
How you going?
All right, what's your name?
Anna.
Anna, my name's Matt.
Hi, Matt.
Okay, I'm going to take you to hospital, all right?
Thank you.
Have you got a lot of pain at the moment?
When I breathe in on the right back side.
Right, on the back?
At the back.
Okay, I'll just do the ultrasound. So, Anna, I'm just going to squeeze a little bit of gel on your chest. Feels a little bit cold. Righto.
Oh.
Can we just get some more fentanyl drawn up, please?
Oh.
So I look at Anna and she's got a large amount of pain. So I'm thinking, has she injured anything in her chest? Has she got some broken ribs? Has she collapsed a lung? Has she damaged her pelvis? Has she got damage to her intestinal organs?
Anna, big breath for me.
Oh.
Anna is in serious trouble here.
Just need 2 lifters, one on the airway.
Back in Geelong, flight paramedic Ray needs to emergency airlift his critically ill stroke patient 70 kilometres back to Melbourne.
Okay, stop there.
But a locked gate at the helicopter landing site is taking up valuable time, with 64-year-old Vicky just clinging to life.
It's a really delicate operation. It's got to be coordinated well, and it's got to be slow and smooth. We're controlling her breathing, and if we lose that tube, basically, she could die.
Okay, are you good?
I'm good.
So we get Vicky onto our stretcher. That move has worked well. All right. And now it's time to get out of there and get back to Melbourne as quick as we can.
And we'll set the back. Roger. The obstacles, light poles off to the right, goalposts there.
As the helicopter takes off, Vicky's husband Andrew and daughter Nicole are now making the 1-hour drive to the Royal Melbourne Hospital.
So one of the limitations of the helicopter is that very few times can we take a relative. And we try to instruct relatives all the time, don't go burning down the road. I don't want to have to pick up someone else in the family. They're hoping we can do our job. They're hoping we can keep Vicky alive. And they're hoping that when they get to hospital, they've got a loved one to see.
Airborne for the Royal Melbourne. She's a 64-year-old lady. She's now intubated, sedated, paralysed, ventilated.
This morning, all seemed completely normal. Andrew's wife of more than 30 years was at home while he was helping out at the local Salvation Army. Then came the news. Vicky had collapsed.
I saw the ambulances and paramedic cars and fire trucks, and I didn't know what to think. And then I rushed in the house and saw my wife we could lose her at any time, you know. It's very confronting and very emotional for the whole family. We're very close and very loving. She's just a decent woman.
India, 3 miles south of Lebanon, Bob Tower, 1,500. Ready back for the Royal Melbourne Hospital, not above 1,500, request clearance.
I look at Vicky as we're travelling into Melbourne, and I really am anxious as to what her prognosis is. Whether it's a bleed or whether it's a blockage in her head, something is significant enough to make her unconscious. The prognosis for that is generally poor. For Vicky, this is going to profoundly change her life, if she survives at all.
Do you want some help, Maria?
Let me do how I come every day.
Okay. Good job.
Across town, Risky and Nicholas suspect great-grandmother Maria may have a nasty urinary tract infection.
Now we just need your bottom up nice and high up here, okay?
Daughter Helen and son George have never seen their brave mum so unwell.
You're fine, you're fine, you're fine.
This could be quite serious for Maria, given her age. Elderly patients don't tend to deal with infections as well as younger people.
And let's head off to Footscray. Maria, do you know what day of the week it is today? Good. It's quite common for a urinary tract infection in the elderly to cause them to have some confusion. So now that we're in the ambulance, I want to check Maria's mental state. And I do this by asking some simple questions to make sure she's aware of what's going on. Do you know what month it is?
February.
Good.
Maria's been able to answer all the basic questions, so Nicola's decided she might be ready for their brand new test.
Just wondering if you can say Cororoit Creek Road 5 times in a row, really fast.
Cororoit Creek, Cororoit Creek, Cororoit Creek. I'm not very good.
Oh, you were doing well. Pretty well. You did better than Nicola.
Yeah, you did better than I did. It's not something we normally ask everyone. She's nailed it. So now that we've got Maria to hospital, we'll take her inside where they can run some tests to make sure that this is just a urinary tract infection. Then they can manage it from there and hopefully she's going to be okay.
Thank you. Thank you
You're welcome.
very much.
No worries.
And I wish you, God, to have you strong and help the people.
Thank you. It's been a pleasure. You're a nice patient.
The grateful Maria will now have blood tests to confirm if she needs to be treated for a dangerous infection.
Almost there.
Anna, big breath for me.
At Phillip Island, flight paramedic Matt is concerned that 56-year-old Anna may have suffered life-threatening internal injuries in a shocking car crash. Anna was driving her 2 granddaughters to school.
Where are the girls?
They've gone to Melbourne Hospital.
Yeah, they're going to go to Monash with the young girls.
So if I had been in a car accident and I had injured my own children and then been separated from them, I would be emotionally distraught, worrying about what had happened to them. What type of injuries have they got? You know, the emotions and the concerns that Anna would be feeling at this point would be very overwhelming.
So the littlies are okay, all right? The kids are fine.
Sorry, I know that hurts a little bit there.
When the airbag didn't inflate, Anna took the full force of the impact. Matt's checking her for a potentially fatal collapsed lung.
Righto. Both lungs are inflated there, but I think you've got a broken rib or two there on the backside on the right.
By ultrasounding Anna's chest, I can see that her lungs are inflated, but there's a high suspicion that she has got bruising on her lung tissue. And so it's really important that we transport her to a trauma centre as early as possible.
Right, Anna, I'm going to give you some more medicine now, which is going to make you feel a little bit sleepy, but I want to make you comfortable because we're about to move you from one bed to another.
I still don't know at this stage whether Anna has sustained injuries to her spine, whether she's broken her pelvis or anything, so at the moment I need to treat her as gently as possible.
So Anna, I'll get you alongside another bed and slide you across onto it. Just relax back as we do that, nice and slow, no rush. So just stop there for the moment, Tony. If you can roll Anna so we can get this underneath her as we turn.
During the transfer to the chopper stretcher, Matt puts a precautionary pelvis brace on Anna.
3, 2, 1, go.
Sorry, Anna. Almost done.
Okay, no worries. Bit of discomfort in your hips here as I pull this tight.
Okay.
All right. So on your call there, Tony.
Okay, 3, 2, 1, go. Lovely.
Right to go, no brakes on. All right,
With the grandmother now safely on the chopper, it'll be a 30-minute journey to the Alfred Hospital.
The likelihood is that Anna's got multiple fractured ribs, potentially bruising on her lung, possibly internal injuries which we don't even know about yet. So it's really important that we take Anna to the appropriate trauma centre.
Anna, we're about to go into the Alfred Hospital. As we come in, it gets a little bit bumpy and a little bit shaky, okay? That's normal. You get a lot of vibration through the helicopter.
Anna has remained stable throughout transport, which is great, but we're still very concerned. She's not out of the woods at this point. She needs to go and be assessed and determine how severe her injuries are.
We've got a suspected spinal injury. Okay, she was on the Aqua Fun Park inflatable and she slipped off.
In Melbourne's southeast, a fun day out at a water park has turned into a nightmare. It has Micah single responder Al on high alert.
She fell into the water and she heard a crack in the middle of her back.
So the case we're going to now is a 20-year-old female. She may well actually have a severe neck injury.
So she's out of the water, just confirming? She is out of the water. She's lying on a spinal. Yep, okay. I've organised some help there for her now.
Since the accident, the girl's been unable to move. After more than 20 years on the job, Al's acutely aware that spinal injuries can lead to permanent paralysis.
No worries. The worst outcome is that you end up either a quad or a paraplegic. We don't want her to be in a wheelchair.
Little bright for you now, mate? Yep.
It's a relaxed start of a new shift for paramedic veterans Cam and Dodsey.
There's a nudist beach down here. We might get a job down there.
Oh.
So if we go to a nudist beach, do you reckon we have to conform with policy?
I'd like to think so. That's an interesting question.
You can still wear your safety vest.
Mine's very short.
What about your vest?
Yeah. Dodsey's a good mate of mine. I love working with him, and it's always a laugh. And in between jobs, you know, you really need to wind down a little bit, so... But just the thought of seeing Dodsey nude on the beach, maybe in his ambulance vest, it's probably something that nobody should say.
Thank you very much. Try the chicken.
But an urgent call changes the mood in the ambulance.
Micah 30 on code 1, it seems like this car out of vehicle is on its route.
Micah 30 received, thanks.
The accident is 80 k's from the city on the Mornington Peninsula.
So, car accident, query rollover?
Yeah.
So it's on this road, so straight ahead.
Thanks, mate.
More details are now coming in to emergency services.
How many vehicles are involved?
One, and the car just did a flip and it's ended up on its roof. There's got to be people hurt in this. There's got to be.
Is there any fire or smoke?
There is smoke coming. Not dust, smoke. I hope everyone's all right, but I don't think they are.
Clear left.
Thank you.
Roll over to me, I think trauma. I think, you know, people have been thrown around in the car, possibly hit their heads, a lot of damage to the car and a lot of potential for injury to people.
There it is on the right-hand side.
So just arriving, looks like a single car, still on its roof.
There's no one in it by the looks of it.
So when we first arrive, it's chaotic. You know, there's a lot of bystanders. Often the hardest thing is working out who's involved.
Hello, I'm Cam. What's your name? Jenny? Okay.
The two occupants of the car have already managed to get themselves and their pet dog out of the wreckage. But things are tense.
What's your name, mate?
Ray.
Ray?
Ray.
Craig.
Yeah.
Good on you.
I was driving.
Yeah, okay. Hey, Craig, could you pop the smoke out for me, mate?
No.
All right.
When I first meet Craig, I'm a little bit cautious just because I've been told that he is impaired by alcohol.
Thanks, mate.
I just had a car roll over, mate.
I understand. And this one, is this one all right? Seems okay?
I know, can I talk to you?
Craig's probably really concerned not only about his partner, but about his dog. It's not my job to judge him, it's my job to treat them medically.
Hey, Craig, you've got cuts and grazes all over you. Is that just from when you crawled out?
Through the barbed wire fence. All worried about that.
Yeah, I'm going to look after her, but I just had to check on you both as well.
So just because Jenny and Craig have got themselves out of the car doesn't mean that they haven't got injuries. So they could have internal bleeding, they could have even broken bones, but either the alcohol or the adrenaline that's surging through their bodies is masking a lot of that at the moment. So until we have a good look at them, we don't know what's going on.
Yeah,
Watch your back, watch your back, watch your back, watch your back, watch your back.
What happened? Do you remember what happened?
Yeah, I slipped and kind of like bent in half and my back made a big cracking.
Okay.
Back at the water park, intensive care paramedic Al is about to assess 20-year-old Alicia for signs of a broken neck or back.
Where did you bend in half? From sort of near your neck or your chest? Or so if I was to point,
Yeah, right. Sort of behind.
just pretty much umbilical region. You went like that. When Alicia told me that she heard a little snap, certainly that heightens your suspicion that there's potentially injury to her spine. Got any pain anywhere?
Just where it's cracked.
Al's now searching for any telltale signs of a spinal injury. Sensations like pins and needles, numbness, or no feeling at all.
Lift your arms up and grab my fingers. Can you do that? Can you squeeze? Squeeze really, really hard as you can. Is that aggravating any pain anywhere? Aggravating your back, okay.
Alicia's boyfriend Sean was by her side as their fun day turned into disaster.
She bent backwards and then fell into the water. We were all laughing at the time, and then she bobbed back up and she was in tears, and then I guess all of our hearts just sunk, really. We didn't know what happened.
Alicia, can you just push against my hand? Can you do that? Don't do it if it aggravates it. Okay, that's all right.
Alicia wasn't in a good state. She was very upset. She said her legs were a bit numb, so it didn't sound great.
Just tell me if you feel any difference here at all on your face. Nothing? No? Okay, that's good. After doing the assessment with Alicia, I feel as if things are going to be good for her and okay for her, but I can't give the all clear. The issue for her is that she needs further specialist examination to ensure that she hasn't done permanent damage.
You've got some pain in the back. Did you hit your head? No? No. So you didn't lose consciousness?
On the Mornington Peninsula, intensive care paramedic Cam is also starting to worry that one of his patients has suffered a debilitating back injury.
Is that sore down there? Okay, and it goes across here. Okay.
Jenny, her husband Craig, and their pet dog Bob were in the car when it flipped and landed on its roof.
Did anything hit you in the car?
Jenny herself initially seemed relatively well, but the more I speak to her, the more she starts complaining of this back pain.
Hey, Jenny, whereabouts is the pain? I'm going to work my way all the way down, okay?
Anything could come of it. It could be a soft tissue injury, she might have been hit by something, she might have twinged a nerve, but it could be a spinal fracture or something that's really going to be time sensitive, and she might need a trauma centre.
If I bring the bed over to here, are you able, if I assist you, to just pop onto the bed? Is that okay?
I don't know if I want to.
Okay. What about if I give you something for the pain? Listen to me for a moment, okay? I'm going to look after you. Okay, I'm going to do...
I don't want to end up with back pain for the rest of my life.
No. Hey, Dodsy. Can I have pen train, please? And then the bed all the way in here. She's really worried about her back.
So in the state that Jenny's in at the moment, she's single-focused on having this back injury. Regardless of the discussion we have, regardless of the advice we try to give her, she doesn't want to move. We have to be persistent because she could have injuries that could be quite catastrophic.
Listen, I'm going to give you some medicine to breathe on, and then we'll pop on the bed.
No, that's no.
Just a couple of bumps, love.
20-year-old Alicia's heading to hospital after a potentially devastating fall at a water park.
You all right? Okay.
Alicia's boyfriend Sean is doing his best to keep her spirits up.
How long have you been going out for?
Over 6 years now.
6 years?
Yeah.
Jeez, you're almost married. It was great for Alicia that she had Sean with her. Patients are vulnerable. They're in a situation that they never would have imagined they would be in. So it makes a big, big difference. Nearly there. Okay. Okay. Now, are you worrying about what's going on? Are you scared about things? Good. That's the best way to be.
If a permanent spine injury was to happen, Alicia wouldn't be able to do her horse riding, wouldn't be able to ride motorbikes, you know. It'd be a very different lifestyle for us both.
The ambulance has now arrived at Dandenong Hospital. Sean will soon find out how much damage has been done to Alicia's spine.
You right, mate? Okay. Yep. Fingers crossed that she's actually going to be okay, and she'll eventually walk out of that hospital as opposed to potentially being in a wheelchair with long-term disability. That'd be a devastating news certainly for Alicia and everyone around her.
Okay, so what we'll do is we will assist you onto a bed. We'll give you something for the pain.
Intensive care paramedic Cam is doing everything he can to convince Jenny that she needs to go to hospital after a traumatic car accident.
Hey, pop us your wrist, hon. I just want to feel your pulse, okay?
She's in intense pain after crawling from the wreckage of the car.
I want you to hold this for me and pop this bit in your mouth and little breaths. I need that medicine to go back into your lungs, okay? Slow down, nice little breaths, okay?
Cam's hoping that once the pain relief kicks in, Jenny will finally agree to be put onto a stretcher.
I'm going to have to get you to move a little bit, okay? Can you feel your feet? Yeah. Okay.
So now I've given Jenny some pain relief. She's a little bit more relaxed and she's compliant. So finally we can start to move Jenny onto the bed and get her into the back of the ambulance.
Just really gentle, mate.
You come,
That's
Jen.
the way. That's the way.
Just do it in stages if you need to.
That's the way.
Another paramedic crew will transport Jenny to hospital.
Sweetheart, no more shaking and no more nodding your head, and I'm going to put a collar on.
We put the neck brace on just as a precaution so she doesn't move her head anymore. And this is purely to prevent further injury later and bring everybody's attention to the fact that she hasn't been spinally cleared yet.
Oh, well done. Well done.
Nice work, lads.
With Jenny on her way to hospital, Cam is turning his attention to Craig, the other survivor of the car rollover.
Hey, Craig, we're looking after Jenny, mate, and I'm worried about her because with a rollover like this and trauma, you can have internal injuries that we can't see. I don't think that you can make a sound judgment at the moment with how impaired you are. I would like you to pop down to hospital just for a checkup, mate. You've been in a rollover, you've got cuts all over you, and you're impaired.
You gotta look after him, mate.
I want to have a good look at Craig. He's covered in cuts and grazes, and I don't know if it's from him just trying to get out of the car or if he's sustained some serious whacks and possibly internal injuries. But he's so preoccupied, concerned for the dog, and I understand that. It's probably a really good mate of his, but my focus at the moment is him.
You are no good to Bob if you're dead. With us, Craig, I'm sorry, mate, it's a hospital. These guys have said that they'll look after the dog.
You won't eat, you won't drink.
Good Samaritans have agreed to look after Bob while Craig and his partner Jenny go to hospital.
I think Bob will behave. Are you right with that?
Yeah.
Craig, he's hard to win over. That's the thing about being a paramedic. Sometimes you think that you're going to roll up to guts and gore and people hanging out of car wrecks, but in the end, you might just have to use your interpersonal skills to win people over, to get them on board with what's best for them.
Craig, this is Steph. She's gonna pop you down to Frankston to get you looked at, okay, mate?
Yeah, but the big problem is him.
You don't want to send him off with these people?
He won't go.
No. Is he a bit stubborn, is he?
No, he just doesn't like crazy.
Okay.
They look like nice people, though.
Let's try.
Try it.
Come on, Bob. Come on, Bob.
First, it took a while to get Jenny compliant. Then I've finally got Craig compliant, and just when we think we've had a win...
Hey.
Bob keeps stopping and looking at him.
Bob decides he doesn't want to go off with these other people. So we're back to square one.
Go on, Bob. Up you get.
But with an encouraging pat from Craig,
come on, Bob.
Bob gets moving.
Finally, Bob's decided to go with the Good Samaritans,
And there you go, Bob's in the back of the car.
but we've still got to be careful the way that we treat Craig because he's just as likely to change his mind at any time.
Craig, let's go. Steph will take you over to this ambulance.
They've got a member going with you as well.
With Ryan, okay?
I've been to a lot of these accidents before. Cars rolled over, alcohol involved, and people die in those accidents. So Jenny, Craig and Bob have been very lucky.
How's the poor dog, mate?
Well, Bob's gone home with that nice couple that stopped and assisted.
Yeah.
You know, which is good for them. They don't have to do that.
Once
They're
again,
taking on
the
the
best of
responsibility.
society, mate.
Mate, it just reiterates to me that there's some bloody good people left in the world.
Got any pain anywhere?
Just where it's cracked.
When 20-year-old Alicia crashed onto her back at a water park, it was feared she damaged her spine.
Are you scared about things?
Come on, boy Jax.
But today, the future's looking bright for Alicia and her boyfriend Sean.
It was very scary when it happened. I was expecting the worst and it could have been anything. It was only once I'd had the x-rays and then I actually found out that it was just a strained ligament, so it was best case scenario, I think.
Untangle yourself.
Come on.
Come on.
Bye.
For Anna, it's been 5 weeks since her horror car accident as she was driving her 2 granddaughters to school.
Where are the girls? They've gone to a Melbourne hospital.
Sophie and Zara were lucky and escaped with only minor injuries.
Hello, how are you?
Today, with their mum Rochelle, they're visiting Grandma in her rehab hospital.
Good to see you.
That's my baby.
I had 2 broken ribs. I had 4 fractures in my pelvis. They said you won't be able to weight bear on your legs for 3 months. They just told me on Friday that I can actually hobble on this one, and actually I can't stand on this one for another 6 weeks, so we'll see how we go. All I remember is I looked and there was just this car right in my face. Sophie jumped out the car, the little one, was screaming, saying that she'd hurt her head a little bit. Afterwards, it dawned on me and I was just, even now, I think, my God, that was a godsend that we came through okay. You feel all right, Zara? I'm just so relieved that the girls were okay. It just shows you how life can be changed around just like that. It was a hard thing we went through, wasn't it? Yeah. Yeah, but it's all good now. It's getting better every day, isn't it?
So you still have the headache now?
Great-grandmother Maria had a terrible headache, and Risky and Nicola were worried she was suffering from a nasty urinary tract infection. But tests ruled out a UTI, and the 89-year-old was treated for dehydration and went home later that night.
Thank you.
You're welcome. It's been a pleasure. You're a nice patient.
Yeah,
Watch his back, watch his back, watch his back, watch his back, watch his back.
Jenny and Craig and their pooch Bob managed to escape their frightening car accident with only minor injuries.
Bob.
Shake. Paul, good boy. As soon as I knew I'd lost control of the car, I feared the worst. No one's going to survive. We're all going to be dead.
Craig had a couple of beers. It was the worst decision.
We could have killed other people.
In one way, we're lucky the car flipped and stayed on its roof. It could have swung back and taken out a family going out for a Sunday afternoon drive. And neither of us are the type of people that would be able to live with that.
Go, Bob, go! Go get it, Bob!
It was a miracle, absolute miracle. The next morning, I still had my best mate Craig, my best mate Bob, and that's pretty good.
Lovely walking. Lovely, lovely walking. How are we going to get you clean, hey?
As for Vicky, she was emergency airlifted and rushed in for major brain surgery after suffering a massive stroke. The 64-year-old remained in an induced coma for 3 weeks, close to death.
The doctors didn't really think she was going to make it. Mum's everything. She's like the strongest woman you'd ever meet.
All right, come on, Del.
Come on, Dad.
Just walk over there.
Yeah, I'm trying.
6 months later, Vicky is finally taking her first steps.
It's about time we got to do some exercises.
Oh,
all right?
really? Okay.
All right, so you got to do the 1 steps at the back. She's got a long battle to go. 2, 3. We have lost her, a little bit of her. But hopefully we'll get it all back. If not, we'll be glad what we got. 7,
9,
8,
10.
9. Another 1, come on. 10, now backwards.
Just got to be optimistic. You do find an inner strength.
And my boobs out far enough.
Yeah.
I feel lucky to be alive. So I've still got a whole lot of living to do with my husband and my children and my 13 grandchildren, and no bloody stroke's going to take me.
Oh.
Here I am. Yeah, it's all good. All good.
Emergency services, tell me exactly what's happened.
Okay, so I just saw this guy just drove right into a pole.
Is he awake?
No, he's got his eyes closed. He's breathing very hard, and there's a lot of blood coming from his abdomen.
All right, I'm organizing help now. Just stay on the line. I'll tell you what to do next.
Paramedics Mike and Eamon are on their way to the confronting car accident.
So we're going to a person who's driven their car into a pole. It's a 45-year-old male. They're presenting as not alert, sending the cavalry.
That's us. Bumps. No.
Oh, let him have it, Foxy.
The case is a priority 0.
Bumps.
The highest level of urgency.
Do not move him unless he's in danger.
Oh, he's frothing at the mouth now. He's frothing at the mouth. It looks like he's having a heart attack.
Okay, all right. So are there any obvious injuries?
Yeah, a lot of blood. A lot of blood.
Okay.
All right, so we got a single responder on scene.
A single responder is calling in with news from the crash site.
Looks like a stabbing prior to them.
He's been stabbed.
He's been stabbed. All right.
Not only has he crashed his car, he's been stabbed prior to this. What has happened? All of a sudden, we've gone from a serious traffic accident to what sounds like an even more serious stabbing.
Check the left for me.
Clear.
Thank
All
you.
right, let's go. We're going to get to this guy. He is not well. This job is 10 out of 10. We are go, go, go.
I'm bored again.
Only boring people get bored.
It's definitely a less dramatic start to the day for Taz and Amanda.
All right, let's play a game. I Spy. We're playing I Spy.
How do you play that?
Have you ever played I Spy?
No.
So I say, I spy with my little eye something beginning with B.
A burger?
Can you see a burger? Where's there a burger?
There wasn't any.
It's really hard to play I Spy with someone who doesn't know how to play I Spy. You just sort of know how to play it, don't you?
Building?
Yes.
There you go.
Now it's your turn. So basically,
I play cricket.
Okay. Well, we can't play cricket while we're in the car.
Fortunately for Taz, the game's now over and it's back to business.
Emergency services, tell me exactly what happened. He's got pains under his heart. And is he completely alert? No, I don't know. Is he responding appropriately to you? Hello, Raymond. Talk to me.
We've just been dispatched to a code 1.
Traffic's pretty epic for a code 1.
A 76-year-old male has got pain under heart.
Okay.
And he's got history of stents.
Right, so he's got cardiac history.
He's got cardiac history, so could be a real deal. If a person is going through some acute cardiac crisis,
I can't go anywhere.
There's no space to move.
Nah, nowhere.
Every minute, every second counts. Oh, God, there. So time is tissue.
Time is tissue.
When talking about time is tissue, what we're referring to is the amount of time that the tissues in the heart are starved of oxygen and blood flow.
It is about 3 minutes.
As they're starved of that oxygen and blood flow, the muscle actually starts to break down and die. So time equals tissue death. This could absolutely be life-threatening.
Oh, no!
So he's bleeding and he's frothing from the mouth.
Airway, hemorrhage control, prepare for a traumatic arrest.
Mike and Eamon have arrived at the accident crash site, where a man has been found slumped behind the wheel, bleeding heavily from stab wounds.
Have you guys got a stretcher? Yeah.
Single responder Ryland was first on the scene.
He's got lots of stab wounds here. He's just seen to veer onto this side of the road.
I'll come in the other side, get a quick set of numbers. Mate, what's your name? Can you talk to me at all, mate? It's the Ambos.
He won't reply.
Can you talk to me at all, mate? Mate, open your eyes.
Multiple stab wounds. Multiple. Yep.
Right upper arm and left.
Roger. Looks like a chest wound. There's blood everywhere. It's painted up the inside of the door. The guy's sitting in a puddle of blood in the footwell. It's probably the most amount of blood I've ever seen.
Hey, what's happened? Have you been stabbed?
He won't talk to us.
The driver is refusing to give any information about what's happened.
We need some O2 on him.
When you've got a patient as unwell as this gentleman, you don't have time to play detective. You're just thinking about what's there in front of you and how am I going to save this person from dying today.
Have you got pain anywhere, mate?
It's a chaotic scene. There's police everywhere. And my big worry with any patient that has sustained a chest wound is that it can cause their lung to collapse, either from air or blood.
He's got equal air entry.
For now, the man's lungs are clear, but his life is still in danger.
Because of all the blood loss, he's starting to lose consciousness. I'm really worried that this patient could go into cardiac arrest.
We're going to get you out of the car, mate.
Paramedics urgently need to get the driver to hospital, but getting him out of the small car is a massive task.
I think we've just lost consciousness. You've got to bleed there significantly.
We're going to just get him out. He's a big guy. He's probably 130 kilos at least. And for us to try and get him out takes a lot of muscle. But if we don't get him moving, he'll die in his car.
If you just went straight, it would have really helped me.
After a stressful drive through heavy traffic, Amanda and Taz have finally arrived at their time-critical cardiac case.
Hello.
He wants to vomit.
Oh, okay. My name is Taz. What's your name?
Cheryl.
Cheryl.
I'm his sister.
76-year-old Raymond is suffering extreme chest pain.
Where exactly is the pain? Show me.
Right underneath your heart.
Just arriving and looking at Raymond, he is displaying the signs of true cardiac event. This is one of the sickest patients I have seen in a long time.
The pain is really bad, isn't it?
Yeah.
Raymond's sister and full-time carer, Cheryl, has never seen her brother in so much agony.
Raymond doesn't complain, but the pain was really bad for him.
Ray, this is pain relief. This is to help.
He was going, I'm going to die, I'm going to die. That's all he kept on saying.
You have Parkinson's?
I don't know.
You do have Parkinson's.
And you had a few stents put in.
He has few stents.
One of your arteries was blocked.
We'll quickly do that ECG.
Yep, so this is the pattern on your heart.
Is it all right?
Well, I'm going to do an analysis now.
Putting an ECG on any patient is fairly routine. However, Raymond has got Parkinson's, so his shaking interferes with the trace that we can see on the ECG monitor.
This doesn't like a lot of movements in the arm.
As feared, the ECG is inconclusive.
Oh, my heart.
But Raymond's symptoms suddenly take a turn for the worse.
It's the pain, is it?
Yeah.
Okay. I think you need to go to hospital. We need to rule out whether you're having a heart attack. Do you think you can sit on this orange chair?
Sit, good man.
I'm very concerned about the condition of his heart. It can stop all of this sudden and he can go into cardiac arrest and die.
How are we going to get to the fifth hole? Let's go on the buggy.
That would be hilarious.
Come on.
Across town, Nat and Leonard are on their way to help a golfer who's suddenly feeling subpar.
Here we go.
Oh, can I drive the buggy? Do you think they'll let me drive it?
I'm thinking, and we get into the buggy with all of our gear and we set up around the fifth hole and it's a beautiful sunny day.
Hello.
Hi. Oh, they're just coming down now in the car.
Oh, they're in the buggy, are they?
Yeah.
Oh, there she is.
Hello, are you our patient?
I am.
What's your name?
I'm Rhonda.
So, Rhonda, are you going to be okay to take a few steps into the ambulance? Come over here and sit in. Tell me what's happening today.
Oh, well, I felt sick before.
before I started.
Sick as in nauseous?
Yes.
Yep.
By the time I got to the 5th, I've already played 9 holes. A really good score on the 4th hole, and then I started to feel dizzy.
Yep.
And everything went funny colour.
I might get you to pop your feet up just so we can get a bit more blood pressure to your head.
Oh, okay.
How long were you playing golf before you started to feel dizzy or lightheaded?
2.5, 3 hours.
So Rhonda looks a little bit lethargic, maybe a little bit tired, and given the length of time that she's been playing today, it's a good chance she could be dehydrated or overexerting herself on the golf course.
I was determined.
You're always
I was
determined.
pushing through the nausea.
It becomes pretty clear that she's a tough cookie. When you had a big kind of swing, you didn't kind of jolt your neck?
No, the last hit I hit was a great hit. Then I had 2 putts and had a 3-pointer, so I'm having...
That's good.
Yeah.
Rhonda does not come across as the type of person that would ever take a sick day. She's not at all happy with what has unfolded today. She was playing a great game of golf, was almost at the end of it. This has ruined her plans, basically.
Blood pressure's still reading now. Who do you live with at home?
Oh, the old man.
The old man? Would he be happy to hear that, the old man?
No, 60 years this year, him and me.
Really? Goodness me.
Fancy living with
How old were you when you got... How old were you? 20?
You're 80?
Yeah.
No.
You are not 80.
No, not yet.
Okay.
I would have picked you at 60, 65 years old.
But while Rhonda may be in good shape, Leonard has just discovered a worrying sign.
Your blood pressure is on the lower side.
Yeah, my blood pressure's usually high.
Yeah.
Low blood pressure.
Usually gets all funny.
I have low blood pressure.
Lots of different reasons. Even though Rhonda's really bubbly and quite upbeat, very low blood pressure in a patient is never normal, particularly for Rhonda, who normally has high blood pressure. So the question is, why is your blood pressure low?
But I've never had low blood pressure before.
This means there's not enough blood and oxygen going to the brain. I need to find out what's causing this because it could be a poorly functioning heart or, worst case scenario, even a heart attack.
I don't normally do sick.
You don't normally do sick?
Sick, yeah.
Let's go.
Back at the scene of a mysterious car crash, Mike and Eamon are urgently trying to get the driver out of the car before he bleeds to death.
I'll board up the bed.
The man has been stabbed, but he's refusing to talk about the incident.
Ready? 1, 2, 3.
So it appears that this bloke's been stabbed whilst he's sitting in his car. He's then tried to drive that car, and because of all the blood loss, that's caused him to then crash it into a pole.
1, 2, 3, 4 in there. Take 5 now. Over here.
It has taken only a few minutes to get the patient out of the car. Now, the paramedics quickly check for any more stab wounds.
Just roll him over. See if there's anything obvious. Just what?
Nothing obvious. We might just have to quickly come this way.
Just roll the other way as well.
That's all good, is it? This upper arm one's fine.
Yeah.
I don't know where all that blood's from. Most of the blood's coming out of this one. Yeah.
Let's get him in the car. Let's go.
Ready to move?
Let's go. We're going in 16.
Brakes, brakes, brakes. Let's go.
It's a rapid transfer to the ambulance, where the man will be put on high-flow oxygen and rushed to a trauma centre. If the man loses any more blood, it could be fatal.
I'll drive these guys.
Green, yeah, I'll follow, mate. I'll meet you up there. Can you drive carefully? Good afternoon, Alfred. This is RC715. We have Micah 16 loaded to you approximately 25 minutes away with an estimated 40-year-old male who has multiple stab wounds to the chest and upper arm.
Stay still.
The patient's super sick. He needs to get to the top level of care really urgently. One of the police officers asked me, is he going to be all right? And I said, honestly, I don't think this guy's going to make it to hospital. He is so unwell.
Can you hear me? I'm not going to hurt you. You're in the ambulance, okay?
So we've got our Micah paramedics in the back at the moment. They're just trying to control some of that bleeding and get plenty of oxygen to his brain as well.
His chest was initially clear and equal, Aaron?
Yeah, equal air entry, top to bottom.
Could have changed by now.
The Micah specialists are worried that a hemothorax is forming in their patient's chest. The bleeding in between the lung and the chest wall could cause his lungs to collapse.
Big deep breath. Good man. Do it again, big breath. He's a lot quieter over here. I can hear this lung, but it's diminished on his right. Is your breathing difficult?
Is your breathing difficult? Yes. So probably has been
If the hemothorax continues to grow, he could stop breathing.
You hear me? Open your eyes. You hear me? You hear me? I need you to talk to me. We're in the ambulance.
As they approach the hospital, the man is now unresponsive.
All right, we're ready to go, gents?
Only time will tell if surgeons can save his life.
Ray?
Oh, this is the worst pain ever.
Taz and Amanda are also under the pump. They're transporting 76-year-old Raymond to hospital with a suspected heart attack.
We don't want you in pain, Ray. I feel very emotional about cardiac jobs because I have lost a couple of family members in India purely due to lack of pre-hospital care. So if I can make a smallest of a difference in making those families not to go through what I have gone through, it's a win-win situation for me.
To reduce the stress on Raymond's heart, it's crucial Taz keeps him as calm as possible while the pain relief kicks in.
Ray, what did you do in your young days?
I used to do paper rounds.
And was that your job for a long time?
No, he didn't work. He's been on pensions until 16.
Oh, okay.
Raymond's battled serious medical conditions his whole life. For the last 30 years, his sister Cheryl has been his full-time carer.
Somebody had to look after him. He couldn't look after himself.
Okay. So it's good to have a sister like Cheryl, isn't it?
Oh, yes, it is.
When you come across a relationship like Ray and Cheryl, it gives you a hope in humankind.
How's the pain, Ray?
Going all right.
Good.
Yeah?
I'll take that as a compliment for my work.
You're doing a good job.
Thank you, Ray.
To everyone's relief, Raymond's agonising chest pain is, for now, under control.
You need to keep talking with me. Talking let the paramedic know the patient is still alive.
You from India?
I am.
You know where to feel on top of your head?
Oh, yeah, the turbans. No, I'm not from turban area.
Oh.
No.
Beautiful teeth.
You've got beautiful teeth.
I know, they call me the Bollywood version of Denzel Washington. We need to look after our teeth, right? Because during the night time, I have to smile so people can see me.
Raymond's definitely feeling a lot better, but Amanda and Taz are worried about just what doctors will find.
Hi, Ray.
Hello.
Feeling better?
For somebody as frail and unwell as Raymond, a cardiac event could potentially be life-threatening.
Golly. I'm just going to clean up. I've got blood everywhere.
Still at the Alfred Hospital, Eamon faces the mother of all clean-up jobs after dropping off his critically ill patient.
I've got an ambulance stretcher that's got blood all over it. I've got an ambulance that's got blood all through it. And I've got to restock a million things. There's so much work to get this ambulance operational again. It's the sexy side of the job. Nah, this is just going under a shower. All our equipment's made to be really robust, so we can just chuck it under the shower and get it sterile again.
Oh, it's on the wheels.
So blood pressure is still 87 on 59.
I can't believe how low that is.
Back at the golf course, Rhonda's game's on hold after nearly passing out at the 5th hole.
It's actually not gone up at all, really, now, with your legs up and all that.
Nat and Leonard are concerned her low blood pressure could point to a heart problem.
Stick your tongue out for me. It's a little bit dry.
It feels dry.
It is a warm day. It's 28 and it's sunny as anything. Hopefully, it ends up just being dehydration. But it's still important that we transport her to hospital for further investigations and to make sure that there's nothing else going on today.
Certainly, the low blood pressure is not affecting Rhonda's sharp humour.
Now, can I do anything for you?
Yeah, you need to do something.
Yeah, Nat, listen to the patient, please. Now, you probably know what's happening, but it's going to be a bit of a sting.
Oh, I can cope. Pretty tough.
I know you're tough.
To get Rhonda's blood pressure back up to a normal level, Leonard is now giving her intravenous fluids.
All right? Yep, it's in.
But before they can head off, Rhonda's equally tough golf buddies descend on the ambulance.
Hi there. Oh, it's Helga. Hi, darling. Hello, darling. I've got low blood pressure. I don't know.
She's played such a fantastic game of golf that it's sent her blood pressure.
I couldn't imagine her playing a good game of golf. You probably didn't drink enough. You probably didn't drink.
That's what we think. It's a little bit,
a
little bit dehydrated.
I'm not a medico, but that's what I would say. You probably didn't drink enough.
Excuse me, can I say I felt sick before this day.
You didn't sound sick when you had a go at me this morning. So don't worry about it. She's fine. She just wants a bit of attention.
Oh, is that what's happening? What a pair of characters. And I thought that Rhonda is tough.
Thanks, ladies.
Oh, my God.
All right. I think we get the show on the road.
That's my friend Helga. She's worse than me.
Let's do it.
Emergency services, tell me exactly what's happened.
A guy's come off his motorbike on the road, hit a kangaroo and he's cane.
Okay, but is he awake? Is he conscious?
Yes, but he can't breathe.
We are all set at the back, boys, and take off briefly.
At the air ambulance base, Micah flight paramedic Matt is being mobilised to an injured motorcyclist 160 kilometres west of Melbourne.
We're just trying to extricate him from the side of the road.
With the kangaroo population exploding in country areas, both humans and animals are now at much higher risk of fatal collisions.
Everybody imagines kangaroos as these lovely little characters that you go and see at the zoo. But in the country areas, we're talking kangaroos that are sort of 5-6 feet and a big solid mound of muscle.
There's the ambulance down there, 2 o'clock low.
And they take sharp turns without any notification. So if you hit one of those, you're going to cause significant damage to yourself.
How's the roo doing? Not looking good for the roo.
Unfortunately, significant injury to the animal as well.
A local ambulance crew has picked up the patient from the roadside and brought him to the helicopter.
G'day, how you going?
Righto, so this is Guy, travelling on his motorbike at approximately 80 kilometres an hour when he's collected a kangaroo.
Yep.
He's gone over the handlebars.
Sure.
Immediate lower back pain just below the rib cage and complaining of severe shortness of breath.
I'm just going to squeeze myself in here and have a look at you. I'll just have a quick ultrasound of the chest just to see what's going on there. Take a big breath for me.
Can't do it.
Can't do it? Causes too much pain?
Just can't get it in.
Righto.
The ultrasound reveals air is trapped in Guy's chest, making it increasingly difficult for him to breathe. Without immediate treatment, Guy could die from lack of oxygen.
My main focus at this point is to fix that collapsed lung because that's the thing that can kill him right now.
Matt must perform an emergency procedure called a needle decompression.
So what I'm going to do is I'm going to give you a local anaesthetic or a bit of pain relief medication into your chest here, and I'm going to pop a needle into your chest to try and relieve the air out of your chest. Once we relieve it, hopefully that will make you feel a lot more comfortable.
Yeah.
You only need to think about anybody who's been held underwater for a short period of time and you come up gasping for air. That's the sensation that some of them can feel, and it's extremely scary for them. I'm just going to pop a sharp out at the moment, guys, so just be wary of that. So just a bit of a sharp sting now here, okay? What's the matter? What's bothering you at the moment? You feel a bit strange? Yeah, we're giving you some drugs which are going to make you feel a bit funny at the moment. Yeah.
You've got your mate, don't.
As well as a local anaesthetic, Matt's given Guy the powerful pain relief ketamine.
So people react very differently to ketamine. Some can go into a state of anxiety and they can become quite agitated. Okay.
Matt's hoping the drug's side effects won't interfere with the much-needed treatment.
Doing well, Guy.
Any job like this is very stressful. I am in the middle of outback Victoria and I'm a long way from help. And if I'm unable to relieve the pressure that's built up inside his chest, you know, he's in real trouble. He could die from this. Stop against the Sorry, mate.
my blood pressure now?
106/54.
Is that all? That's still low.
Back in Melbourne, 79-year-old Rhonda's on her way to hospital after nearly fainting during her morning round of golf.
But I'm supposed to play Thursday. Well, hopefully I might be all right.
Because of Rhonda's low blood pressure, Nat and Leonard can't rule out a problem with her heart. But right now, this feisty golfer has other concerns.
She wears a driver.
No, she's a good driver. You're lucky I'm not driving.
Are we there yet?
I'm just following GPS.
Oh, don't you know the way to
No, I don't.
Oh, sorry. Do you want me to tell you?
No, I'm following the map. All good.
Where are we now?
We're about to get onto the M11.
I wouldn't have gone the freeway.
Rhonda would have to be the worst backseat driver I have ever had. Normally the patients sit there quietly, let us do our thing. Oh, no, not Rhonda. Do you want to drive, Rhonda?
No, thanks.
Are you sure?
I'm a control freak too.
Really?
Yes.
I didn't notice that.
And
No.
you notice.
What, Rhonda, a control freak? No, never would have guessed that. But that's okay, because I've met my match here.
As they finally arrive at hospital, newlywed Leonard suggests that Rhonda calls her husband of 60 years to let him know what's going on.
Hi, what you doing?
What am I doing? Did Helga ring you?
Yeah.
Oh, no, my blood pressure went really low, which is stupid. So I'm just arrived at Peninsula Private and they're going to check me out.
All right.
All right, so you can come down if you want.
Yeah, I'll come down.
Okay, no worries.
All
All right. See ya.
right. Okay.
See ya.
No, that's fine.
See ya. Bye.
Seems pretty relaxed. I know right now me and Larissa are newly married, so our emotions are very high at the moment, so I'd probably freak out a little bit more, but yeah, after 60 years, that might fizzle out a little bit, maybe.
How was the drive, Rhonda?
Oh, Nat, I thought it was excellent.
Did you? Thank you.
Emergency services, can you tell me exactly what's happened?
My mum's just come off a horse and hit her head pretty hard.
99 received, thank you.
Single responder Glennis is on the way to an SOS from a worried son. His mum has just been found lying concussed on the ground.
She doesn't really know what day it is or why she was dressed to get on the horse or anything.
Do not move her. Keep watching her very closely.
I love horses. I like watching them. I also like having a little flutter on them. But when I'm going to horse accidents, that's a very different kettle of fish.
Riding horses is 20 times more dangerous than riding a motorbike.
If this is horse country, those sirens have to go off. Horses don't go well with sirens.
A local crew have already arrived and the patient's son, Alex, is waiting to take Glennis to his mum.
Hello, do you want to show me where I'm heading? Falling from a horse is really unpredictable. On a best day, you might get a broken arm. On the worst day, you might end up in a coma with a significant head injury. They are so large, they are so powerful. It's not called horsepower for nothing. What's Mum's name?
Annabelle.
Hello, Annabelle. What's happened?
She was essentially saddling up that horse.
Yeah.
She thinks it may have touched the electric fence.
Oh.
She thinks it got spooked. That's the last thing she remembers. Now she's feeling a bit of pain back the head. At the moment, there's a bit of repetitive questioning, so maybe amnesia.
Right.
Although Annabelle has no obvious external injuries, she can't remember the accident at all. A red flag for a potential brain injury.
And how did someone find you? Good question.
Her dog come over to the stables over there and got me.
So you're the neighbour?
Yeah. And my dogs, if he come on the property, usually would attack him. And they did it.
Wow.
And I was
I
like,
could sense something.
what the hell's going on here? I turn around and there's Jacko right behind me. He's never, ever been on the property because he knows he's not allowed. He wasn't very happy about being there. He was panting and what have you. I thought, nah, this is weird. So that's why I came running over. So the horse is here.
Yeah.
So she's landed here.
Yeah, you can see where she's been. Is this the culprit?
Yeah. Feeling very sad.
Oh, I can see. Well, it's probably got a bit of a shock.
Annabelle was sitting in the middle of this yard looking extremely disorientated, and I asked her what had happened and she just kept saying, "No, who are you? Where are you from? And what are you doing in my kitchen?"
I can give you a massage, my love.
While Glenys has ruled out any potential spinal cord injury, she is now searching for signs of trauma to the skull. After hitting her head so hard on the ground, Annabelle could have suffered a bleed in the brain.
One of the things we suspect is that the brain has rattled around in that hard skull, so we have to start hunting for all those little soft spots that may reveal something.
One.
Oh, yes, there we go. You've got a lump, all right. She's got a large bump on the back of her head. 500-kilogram horse knocking you to the ground, striking your head. It wouldn't take much to get a bleed developing on the inside, and this could be very serious.
In country Victoria, flight paramedic Matt is trying to release the pressure in Guy's collapsed lung with an emergency needle decompression. The 56-year-old was on his motorcycle when he hit a kangaroo at 80 kilometres an hour.
Oh, mate, well done.
Any change with his sats there at all?
Oh, no, it's still 97%.
97. I think we've got more air trapped down in this area of the lung rather than up high.
With air still trapped in his lungs,
We can start moving into the aircraft.
Matt needs to get the critically ill Guy to a major trauma centre for urgent surgery.
Are you fine, Tim?
Yeah, it's okay, Guy.
As Guy's life hangs in the balance, his wife Kim has been contacted. The news is even more heartbreaking as her husband is already battling cancer.
The last 3 years have already been a challenge. 2015, he was diagnosed with bowel cancer and then started on chemo. Just to watch someone go through that is very difficult.
1, 2, 3.
This was Guy's first time back on his much-loved motorbike since being diagnosed.
That's why I was always keen for him to ride his motorbike, because that's his passion. Your passion keeps you going, and that was a good sign that he was strong enough to get back out there.
All right, guys, let's get into the aircraft.
I thought it was just so unfair that this had happened now to him when he was just trying to get on with things.
Some big breaths for me, Guy, big breaths.
Although Guy needs to get to hospital urgently,
Guy, can you hear me? Yeah, good man.
the helicopter trip could make his condition worse.
Any patient that's got air that's trapped inside a cavity, as I go up in altitude, that trapped air will expand, and so that will collapse his lung further.
I'm clear of the trees on the left-hand side.
And we take a gamble and we put patients in who are really, really crook, but we know that the best interest for them is to be in a place that looks after extremely unwell people.
It's all right, Guy.
Otherwise, the consequences are going to be dire.
Back in horse country, intensive care paramedic Glenys is worried Annabelle could have a head injury after her horse Maggie knocked her to the ground.
What's your blood pressure normally?
Really absolutely normal.
Absolutely normal, all right, because we're sitting really high, okay, 190 on 100. Well, Annabelle, I would certainly like you observed.
Seriously?
Yes. You can't quite remember things and your blood pressure's really high.
Okay.
Okay. Annabelle's pretty adamant that she's okay, but she does need to be seen at hospital. Any head strike, particularly when you're knocked over by a 500-kilogram horse, that's quite significant. All right, let's rock and roll. Is this the hero dog? Look at you. Are you friendly? Hello. What a good boy.
It was only thanks to the bravery of Border Collie Jack that Annabelle was found concussed on the ground. Despite being sworn enemies with the neighbours' dogs, he crossed onto their property and raised the alarm.
Now that dog has stood at this fence line and barked and let that neighbour way over there know something's wrong. That's awesome. It's like Lassie.
Amazingly, the neighbours' dogs let Jack through for the first time ever without a fight.
You think after 27 years you've seen it all, but to hear of animals playing such a significant role in raising the alarm for Annabelle today, that's extraordinary. What a good boy. But we don't know how long she laid there before Jack's found her. So she's by no means out of the woods at this stage.
Thank you, guys.
That's okay.
Appreciate that.
No worries.
Annabelle will now be taken to hospital for a brain scan. Hopefully, Jack's heroic efforts have prevented any long-term injuries.
Is that hard to take a big breath at the moment?
Yes.
Yeah.
In the skies above Western Victoria, 56-year-old Guy is clinging on to life. A motorbike collision left him with a collapsed lung.
I'll do a scan, see what shows up.
Flight paramedic Matt is worried the high altitude could make his patient's condition worse.
Guys all strapped in the back.
But suddenly, there's another problem.
Bit of a storm up here.
When we get a bit of thunder and lightning around, it's not the most comfortable feeling to be inside a helicopter. Essentially, you're flying around in a tin can, and obviously metal attracts electricity, so if we're flying into storms, it becomes quite concerning.
But bad weather is not the only complication. Guy's blood pressure is now dangerously low.
Suspicious that something's bleeding somewhere. Any sort of decrease in the blood pressure that a patient gets, I get concerned about it. It makes me think, is there something else that's going on? Is he bleeding from another area? Is there something that I haven't addressed that's causing him to deteriorate further?
Alfred Hospital. We are inbound to the helipad with an ETA of 12 minutes. It's 2 minutes. No worries.
There's little Matt can do on the chopper for an internal bleed, other than get Guy to surgery as soon as possible.
All right, there's the city.
But the odds are stacking up against him.
Roger, final checks in on 2.
He's not cutting a break at the moment, that's for sure. He has a collapsed lung already. His blood pressure's low, his heart rate's fast, he's bleeding somewhere else. Listen, mate, we're going to take you inside. There'll be a few bumps as we get you out of the helicopter. So my level of concern doesn't stop even when I hand him over to the medical team at the hospital.
Well, it's a nice day, and I'll beat the pants off all of you. I will so.
When feisty Rhonda collapsed with low blood pressure during a round of golf,
I don't normally do sick.
Nat and Leonard suspected dehydration,
I can cope. Pretty tough.
I know you're tough.
but took her to hospital to rule out a possible heart problem.
Can we wait for Judy? She's got little legs.
Luckily, all tests came back clear. Rhonda was put on a drip and a few days later was back at the golf club, better than ever.
Haven't forgot. That's all right. Golf is very important to me. I eat golf balls for breakfast. Miss, yes.
Thanks, Rhonda.
We give each other a hard time, but water off a duck's back and we love each other.
Oh, good shot, Rhonda.
I just want to keep playing golf until I fall over. Keep up.
Mate, open your eyes.
Multiple stab wounds. Multiple.
Micah Neyman's patient crashed into a pole after being stabbed repeatedly and was taken to hospital after massive blood loss.
What's happened?
He won't talk to us.
This is definitely one of the biggest jobs of my career. I'm probably never going to know what happened or who did it or why I did it, but that's not really important. What's important is that he survived, and that's really amazing.
The man refused to give any information about the crime, and the police investigation is ongoing. 76-year-old Raymond thought he was having a heart attack when he experienced agonising chest pains. His sister and full-time carer Cheryl thought she was losing her brother.
I really thought he was gone. So how do you feel today? Do you feel all right today?
Feel all right, lovely.
But test results showed that the pain was caused by 4 gallstones.
You right? Yeah.
After surgery to remove them, Raymond's back at home in his sister's loving care.
One of the best sisters, yeah.
You feeling all right?
Yep.
I don't think you were conscious throughout that episode.
When Annabelle was knocked unconscious by her horse, it was Border Collie Jack who raised the alarm.
Her dog come over to the stables over there and got me.
Glennis was worried Annabelle could have a head injury, but luckily the scans were clear.
It was your fault.
Although Annabelle is back on the horse, there's no doubt who her best friend is.
Jack went next door to my neighbour Sarah. Her dogs, who would normally be really aggressive if he went over there, just backed off. That brought Sarah back over here to see what was wrong. So there you go. Amazing things, dogs, aren't they?
Meanwhile, the temporary truce between Jack and his neighbour's dogs is well and truly over.
Take a big breath for me.
Can't do it.
As for 56-year-old cancer survivor Guy, he was fighting for his life again after a high-speed collision with a kangaroo.
I'm going to pop a needle into your chest to try and relieve the air.
Flight paramedic Matt did everything he could to fix Guy's collapsed lung.
Sorry, mate.
But his future hung in the balance all the way to the hospital. Since the accident, Guy's wife Kim has had to run the farm on her own.
The first time I saw him in the ICU unit, he did say, "I think I died last night." And he said he had the choice to go or come back. So, and he chose to come back. Walk slow. Yeah.
Now, have a look at some of this gear.
Yep, have a good look at your gear. You haven't seen it all properly yet.
No. There was a fractured hip, 4 fractured vertebrae, the front of the left shoulder, the back of the right shoulder, 9 broken ribs, and a collapsed lung. Apart from that, not much.
Here's your jacket.
Jacket. That sure did save the day.
You sad to look at it?
Yeah, it is a bit. It is a bit emotional, actually.
But you're still here.
Yep.
Getting your gear.
Yep.
All right?
Yep. It's been a fair road. I think I was starting to wrap my mind around the whole cancer journey. Then there's a road accident on top of it. But I've got to walk away from a couple of things that a lot of people don't. So I've got to be pretty thankful.
It's all fixable.
Yeah.
You're fixable.